So at this point, you're about 2 months out from your otoplasty surgery, and healing should be coming along pretty well. Remember a very important rule, I cannot state this strongly enough. In my practice, when someone's ears pop loose, it's almost always been inside of the first 6 months following surgery. Meaning that until you reach the 6-month mark from your original date of surgery, you've got to be careful not to hit those ears. Remember the elastic strap that we gave you. A lot of times people go to the store, like a sporting goods store, and buy one that's a little bit, you feel more cool wearing or something. You should be wearing that strap if you do any sort of athletic events. So the obvious ones like lacrosse, baseball, wear the strap first, put the helmet on very closely afterward. Water sports count too though. So if you're maybe wakeboarding, if you enjoy that. We've had kids go to a water park. They don't think about going down a water slide. That's a sports activity. Anything where you could bump your ear, make sure that you have some sort of strap, whether it's just the basic medical one we give you or a cool one you get from the sporting goods store. If you take very good care of your ears and you make it to the 6 months mark, there's no guarantees in healthcare, but I'd say the probability of having a problem with a stitch popping loose after you're 6 months out from otoplasty is very small. We're always available to care for you. If something doesn't look right, let us know. But those are some good guidelines to keep you out of trouble. And one final note about healing. Remember the incisions hidden in the back of the ear. The majority of patients, I would say 80 to 90% of people, never have any trouble with that incision. But a small percentage of people are somewhat genetically predisposed to develop what are called keloids or hypertrophic scars. Typically that is a thickening of the scar in the back of the ear. And most patients will feel the ear becoming sort of excessively itchy, or they may feel a little bit of a fullness on the back of the ear. If you have that, call our office immediately, because if that fullness is not addressed by us, it could lead to a problem that could even require a second surgery. So always kind of be aware of your incision, and if you think you're getting any fullness or thickness to your scar, take a picture, send it to us, and let us answer it for you. We'd rather you sort of burden us, and it's not a burden, but we'd rather you burden us with a question or two just so we know that you're safe.